In the heart of Central America, Guatemala and Panama beacon with their breathtaking beauty. Guatemala, a busy metropolis nestled in the shadows of majestic volcanoes, lakes, and tropical forests. Panama, a modern marvel straddling the Pacific and Atlantic, with captivating mountains rising majestically among diverse landscapes, including impressive ranges like the Chiriquí Highlands and the Talamanca Mountains. Both in Guatemala and Panama, we encounter a beautiful fusion of cultures where indigenous, Afro-Caribbean, Spanish, and European traditions have woven a rich tapestry. Despite progress, beauty, and cultural richness, both countries face significant socioeconomic challenges, including poverty and limited access to basic services like education and healthcare. High maternal mortality rates are particularly observed in both nations. Phalarope, a US-based NGO, initiated the implementation of the Eggshell program in 2019, funded by Rotary International, with the objective of reducing maternal mortality by training traditional midwives in Guatemala. Its success led to expansion into Panama to assist vulnerable communities in the Ngäbe-Buglé region. However, in 2020, the world faced the unprecedented COVID-19 pandemic, causing widespread devastation. This led to a state of emergency, significant loss of life, and disruptions in essential healthcare services. Marginalized communities suffered the heaviest burden due to limited resources and cultural barriers. This crisis doubled maternal mortality rates, strained global healthcare systems, and pushed businesses to the brink of collapse. Phalarope teams continued their work during the pandemic with the support of Rotary International and its leading Rotary club, the Guatamala Vistahermosa Club. They trained traditional midwives to be effective sources of healthcare in a system strained by the pandemic. Simultaneously, Phalarope's team was preparing to bring the program to Panama under the name Manchichi, which means mother and child. With the Boquete Rotary Club and other local partners, they aim to improve the healthcare system in the indigenous communities of the Ngäbe-Buglé Comarca. And so the journey began. The Maternal Child Health Surveillance Program by Phalarope is a groundbreaking initiative in rural Guatemala and Panama. It empowers traditional midwives and healers with medical knowledge and tools, leading to improved care for pregnant women and the identification of high-risk cases in indigenous communities. Traditional midwives learn to take the health history of a pregnant woman during prenatal visits to identify underlying factors that could impact the pregnancy. During the prenatal visit, they conduct a physical examination to identify signs and symptoms that may endanger the pregnancy. They also learn to use medical equipment to monitor vital signs such as blood pressure and blood sugar levels. With training, midwives learn to evaluate fetal growth, the baby's position, and the baby's heart rate. With this information, the midwife can identify if the baby is experiencing fetal distress. The program also includes training in postpartum care for both the mother and the baby, by identifying signs and symptoms that may require proper care. This assessment allows midwives to recognize signs of potential danger, such as hypertension, facilitating early detection and the provision of interventions or referrals for specialized care. Finally, the program emphasizes cultural sensitivity training, recognizing its importance in promoting respect and understanding among diverse individuals, particularly in healthcare. To measure the program's effectiveness, baseline and biweekly data collection are conducted using Esri geo-tracking survey software. This software streamlines data collection processes, enabling the presentation of summary data on a dashboard for program directors, along with clinical information gathered during household visits when a woman is referred to Ministry of Health facilities. By empowering traditional midwives and promoting collaboration in healthcare, this program aims to improve maternal healthcare delivery. It emphasizes the importance of regular prenatal care visits and improving the role of traditional midwives and healers as extension of the Ministry of Health. As the program expands throughout the region, it has the potential to bring about lasting transformation and elevate the well-being of women and children for generations. Empowering and transforming our communities.